and welcome. You're watching FYI. I'm Rishika Barwa. India's COVID-19 cases are on the rise once again. Now, there are fears of a more transmissible, dangerous variant of COVID-19 in India as well. All of this news coming within the backdrop of children going back to school in many parts of the country and many people returning to work, or many who've already returned to work in closed office spaces. Now, while masks and physical distancing is a part of the new normal which we've all embraced, today on FYI we bring to light another key aspect of keeping yourself safe. This key aspect is ventilation. Now, ventilation is as important as wearing a mask or maintaining physical distancing. Let me explain why. COVID-19, as we all know, is airborne. There are guidelines for proper ventilation that have been put in place, and these guidelines are key. Now, focus on ventilation is as important as sanitizing your hands, wearing a mask, or maintaining physical distancing. Now, many experts say that 6 feet of physical distancing is actually not enough to prevent aerosol transmission. Now, if natural ventilation is not an option, then air disinfection needs to be done to reduce the risk of COVID-19, especially in closed spaces. So, how can you better ventilate closed spaces like offices or classrooms? Well, there are expensive measures to do so, inexpensive ones as well, and quite frankly, some pretty genius solutions. We'll try and break down some of that for you on the show today. Now, the US CDC has talked about enhanced HVAC systems, HVAC, which stands for heat, ventilation and air conditioning systems. The CDC says that HVAC systems can prevent aerosol transmission. They can maintain airflow and also filter air to reduce the risk of COVID-19. But it's important to note that they cannot eliminate COVID risk. So it doesn't mean that if you're in a well-ventilated room, you don't need to wear your mask or maintain your physical distancing. Now, there are experts who've also discovered what is called the Corsi box, which is a pretty inexpensive DIY solution to maintaining good ventilation. It's essentially a cube with a fan and filters, so it is cheap. It cleans the air in closed spaces, and it's a simple box fan which has filters on all 5 sides. But the important bit here is that these filters on all 5 sides are MERV 13 grade filters. Now, these are specialized filters that can filter out aerosols. Then, of course, there are air purifiers with the HEPA filter. What is a HEPA filter? It's the high efficiency particulate matter filters. They can augment the HVAC system and also aid natural ventilation. Air purifiers with HEPA filters can actually catch particles the size of COVID-19. Experts also say that air purifiers with a clean air delivery rate, a CADR rate of about 300 cubic feet per minute, are effective against virus aerosols. So just remember that not a plain simple air purifier with a HEPA filter will serve. The air purifying rate also has to be extremely high. They're called high flow air purifiers if you are indeed planning to get one. Well, to explain all of this, we have with us Dr. Eric Fiegeldin, a noted epidemiologist and health economist from the United States. He's been writing extensively on the importance of ventilation, especially in context of schools. Thanks so much, Dr. Eric Fiegeldin, for being with us on NDTV. You've stressed on ventilation being as important as masks and physical distancing. Can you explain why?
Well, ventilation is critical because, first of all, this is an airborne aerosol virus. Previously, we used to think that what you breathe out drops within 6 feet, 2 meters because of gravity. But that's not true. The aerosols float in the air for 20 minutes, 4 hours, or even longer if there's poor ventilation. And ventilation is a combination of getting fresh air from windows or using a filter to clean the air. The problem is, of course, while masks are important, masks do leak, especially in children, and the the aerosols still build up in a room with many people over many hours, as schools oftentimes do. So that's why you need also to replace the air. And there's studies that actually show schools that have ventilation, the children perform better on math. And also the other issue is school lunches. When kids eat lunches at school, it is the same as indoor dining restaurants.
Yes.
And so making sure that whenever they're not masked and eating lunch, that they will get fresh air to make sure to dissipate and clear these aerosols.
All right. You've also talked about how 6 feet of physical distancing is not enough. Now, the rule as far as, say, schools reopening in India is concerned is a 6 feet distance needs to be maintained. Do you think we need to rethink that rule?
Yeah, I think 6 feet can be enough with masking, and also with ventilation. But just relying on kids unmasked to stay 6 feet apart, that does nothing for the aerosols. The aerosols can travel throughout a room. Think of cigarette smoke. When you smoke, you can smell the air to smoke from many, many meters or rooms away. This is why the aerosols for this virus, which you can't smell, does the same thing. So a short distance of 6 feet, 2 meters, just definitely does not protect people. They need to mask and ventilate and get fresh air continually.
All right. That's, I think, extremely important. Now, specifically talking about classrooms where there's no ventilation, and I say classrooms because many parts of India, schools are now reopened. How can you clean the air in closed classrooms?
So that depends if the school has HVAC system, which means, central air that brings in. But for rooms that don't have good central air that brings in fresh vented air, there is either opening the door and using 2 fans, one fan that points in, one fan on the floor that points out. But that only gets you air from the hallway. So that's not perfect either. There's also HEPA filters, which unfortunately costs, $200-300. But there's also something called a Corsi box, in which you take a box fan that's shaped like a simple box and blows, and then you put a series of filters to create a cube out of air filters. And then instead of 6 sides, one side being the box fan, the other 5 sides are air filters. And when you do that, you can actually create your own mini filtration device. And if you get good quality filters that filter out viruses like MERV-13 or higher air filters that can filter out viruses, you can actually create almost a homemade HEPA filter that can filter out viruses. And the cost of this is very, very low relatively, because the cost of the filters and the fan is pretty inexpensive.
So what you're essentially saying is that HEPA filters, which are used in air purifiers, are an effective way to clean closed spaces. Can it also therefore contain the spread of COVID-19?
Yeah, I want to emphasize not all air purifiers are HEPA filters. Some are this ionizing, and some products don't have high enough flow rate. So some of the ionizing ones, the flow rate is very, very low. But if you have a good HEPA filter with a high flow rate of 200, in American units, it's 200 cubic feet per minute, at least, preferably 300 cubic feet per minute of CADR, clean air delivery rate, CADR. If you have 200, 300 CADRs, then that's a good HEPA filter. But many filters and air purifiers don't have that. And so I want to make sure people get the right filters that have the high enough volume of clean air so that you can ensure 5 air exchanges per classroom per hour. That is the best standard for air circulation refresh rate. And so please consider making sure the devices have a high enough flow rate. And that's why the box fan, a fan ensures very high volume, plus the filters can be a very inexpensive solution for that.
All right. So very important that not just any air purifier, but a high airflow of the air purifier is also extremely important. Now, talking specifically about children in schools, because, that's really a big cause of concern here in India. The new variant spreads rapidly among kids, as one has seen it in other parts of the world as well. How vulnerable are children, Dr. Fiegelding, given the fact that there's no vaccine yet for children anywhere in the world?
Well, this is a good question. And I do believe kids should go to school. And I don't think they should stay home forever. But this is why we need to use all of our ingenuity to solve this issue of how to allow kids to go back to school safely. We want to protect our kids and we want to protect our teachers. And so this is why with inexpensive ventilation or these inexpensive air cleaning solutions, we can bring kids back to school even if the virus is still transmitting. Because if you have the safety measures in place,
right,
you can bring kids back to school.
Okay. Well, another very commonly asked question is, is there any kind of set protocol which one should follow at home? Since we're speaking of kids going back to school, there are lots of questions on how you should deal with the kids' uniforms or the clothes that they wear to school or their tiffin boxes, for instance. Is there a set protocol?
Well, the surface transmission of the virus is actually not as big as we think.
Right.
So I don't think the viruses from uniforms per se is a high source
right,
of transmission. I think parents should get a HEPA filter at home if possible, or build this fan filter box combination called the Corsi box.
right.
So again, I don't think it's these clothing that's the main source. So I think everyone should still focus on ventilation at home just the same. And if there is an outbreak, obviously we need to have good tracing and quarantine classrooms whenever that happens for a period. But hopefully we can still keep the whole school open.
Right. All right. Well, Dr. Eric Fiegelden, thanks so much. That's very useful advice that you've just shared with our viewers. Thanks so much for joining us on FYI. Well, with that, we're going to slip into a very short break. But coming up on the other side, we'll answer more questions on just how you can better ventilate your spaces, what you can do in your home, at your office spaces, and most importantly, for kids in classrooms. Our continuous coverage on the other side. Stay with us. Welcome back. You're watching FYI. You just heard Dr. Eric Fiegelden break down the importance of ventilation and how you can better ventilate your closed spaces and how it actually prevents the spread of COVID. To talk more about this, we have Ravi Kaushik. He works with antimicrobial air purification technology. We also have Dr. Vivek Nangia, Principal Director and Head of Respiratory Critical Care at Max Saket in New Delhi. Thanks so much for joining us. I want to ask you first, Dr. Nangia, given the fact that so many people are now back to work in closed spaces, kids are back to school, what do you make of this entire analysis that ventilation is as important as wearing a mask and maintaining social distancing?
Absolutely, Rishika. I fully agree with you. Ventilation is very, very important because ultimately it's a disease which is spreading by aerosol generation. So if whatever the aerosol has been generated is not cleared from the environment around you, then obviously there's a high probability that you would be inhaling the aerosol and then landing up with the infection. Luckily for us, in schools in India, they're not like centrally air conditioned as they are abroad. Most of the schools have the regular fans, windows and doors, and the doors and windows are quite often open only. So that kind of a ventilation is adequate to take care of the virus, especially if there is a fan blowing also.
Yes.
That would usually take care of the circulation of the air and be able to exhaust out all the air if we have enough exhaust fans.
Yes.
In case the rooms are closed or, completely covered.
Okay. Let me bring in Ravi Kaushik into the conversation because you work with very interesting antimicrobial air purifying technology. Now, for the benefit of our viewers, explain to us what is it that you do, and can this technology that's being used in air purifiers, HEPA filters for instance, can they actually prevent or reduce the spread of COVID-19 in closed spaces?
Yeah, thank you. So we have been working on DCD mechanism, that is deactivate, capture, deactivate. How HEPA filters work, they use a capture mechanism. Yes, they can capture it, but they cannot deactivate the pathogens. They are still there, and they can again get into the air, resuspension, which is what it is called at, and can again become a source of disease transmission. So that's what we have been working on at Department of Chemical Engineering at IIT Bombay and supported by IIT Kanpur SIIC. So this is really important to understand.
No, this is very important. And Ravi Kaushik also explained to us, because we had Dr. Eric Fiegelden on the show earlier, and he was talking about, using HEPA filters or using high flow air purifiers as a source of better ventilation, which can actually reduce, not completely remove, but at least reduce the risk of COVID-19 in closed spaces.
Exactly. So the problem that we definitely need to understand in Indian context, that we don't only have airborne disease transmission, but air pollution. Just imagine this room, when it is filled with people, the chances of airborne disease transmission is much higher. Let's say if I open the windows to safeguard myself from disease transmission, I'm exposing myself to the problem of air pollution, and which will create a long-term adverse health effect.
Right. When we talk about COVID-19 being airborne and this entire 6 feet, physical distancing, that's the norm. Dr. Nangia, explain to our viewers what happens, say, in office spaces or even in schools when people remove their mask to eat, for instance. Because what one has understood is that the 6 feet of physical distancing only works if you're actually wearing a mask at all times.
Actually, you're right, Rishika, that physical distancing as well as wearing masks, both are very, very important. But at the same time, we have to understand that whatever protection is being offered, whether with the mask or with distancing, we must go in for that. There is no way that we should be ignoring it completely.
Right.
Whether you feel that only, you have to wear the mask as well as the 6 feet distance, only then you would be secured. That is not correct. You're still secured if you're wearing the mask and not so, the distance is not maintained.
Right.
You're close to some other individual. Whatever little protection happens, but we have to maintain the principles. We have to carry on with the two principles of wearing a mask as well as maintaining that physical distance at all times.
Okay, so masks, so physical distancing and of course ventilation. Ravi Kaushik, I want to give you the last word, because many viewers have actually asked us questions on, what happens now, given the fact that there is evidence that COVID-19 can be transmitted via aerosol. So it is, there is evidence that it's airborne. And now we are heading for summer, wherein again there'll be closed spaces with air conditioners. Do air purifiers work? And if so, which air purifiers will be effective?
Definitely air purifiers work. It is mostly dependent on the CADR, that is clean air delivery rate.
Yes.
But that's what we are working on, how we can deactivate the pathogens which are being only trapped by HEPA filters. So that is what we are working towards with IIT Kanpur and IIT Bombay, and soon we will be deploying it. We are currently in touch with various government bodies to actually deploy it and do a pilot testing. We have validated the technology at CSIR NPL and an NABL grade lab.
All right. Well, we really hope that you do make some technological breakthrough that can actually, help at least reduce the spread of COVID-19. Dr. Nangia and Ravi Kaushik, thanks so much for sparing your time. Really, the bottom line of today's FYI is to highlight the importance of course, wearing your mask, sanitizing your hands and maintaining physical distancing, but in order to also ensure that ventilation is key. Without ventilation, some of these measures may actually fall short. So it's important to either keep your windows open or ascribe to one of the technological solutions that we've presented to you on FYI today. Thanks for watching.